to non-surgical cosmetic procedures. As some of you may know, the APPG was established last year to both celebrate the social and economic contribution to the beauty, aesthetics and wellbeing industry that they make to the UK economy. But we've also worked with the industry to address some of the challenges it faces, particularly around the impact of COVID-19, and will continue to support the industry through this crisis in whatever way we can. But we also want to turn our attention to that of non-surgical cosmetic procedures, which is a topic we've got real concerns about. And that's why we've recently launched an important inquiry which looks into non-surgical cosmetic procedures such as Botox or similar, anti-wrinkle injectables, dermal fillers, now this is challenging, isn't it? Polydioxanone, PDO, I should have just said, threads and PDO cogs. We'll also be investigating how standards for undertaking treatments and their promotion should be improved to support the beauty and aesthetics industry and to protect public safety. So this session will focus on what is the concern around these treatments, and we're grateful to be hearing from people who've received and experienced these procedures as well as administering them. So before I introduce the speakers, I'd like to remind everyone that this session is being recorded and that the recording will be available online. So in this session, we'll be hearing from Rachel Knappier, Dawn Knight, Siobhan Fallon, who both suffered from malpractice when getting dermal.
I think they can hear me.
We'll also be hearing from Michael Aiken, who's an aesthetic doctor and founder of Visage Aesthetics. Helen McGuiness, the centre principal of Helen McGuiness Health and Beauty Training International, and Chris Wade, an aesthetic practitioner and board member of the Hair and Beauty Industry Authority Advisory Board. I'd like to thank the speakers for joining us today. I'll get them to introduce themselves and then we'll open up to other members for questions. So firstly, if I can start with Rachel Napier. Rachel, welcome. You've got 5 minutes. I know it's a bit of a tall order, but please do just share with us your experiences. Thank you, Rachel.
No problem. So I'm going to share with you not only my experiences, but also what I think are the wider areas that we need to look at now. So 2018, I had Botox and lip filler by who transpired to be a beautician with no insurance or medical knowledge to deliver what actually resulted in me requiring critical medical care. The beautician injected an artery which ran from my top lip into my eye area, caused a vascular occlusion, blocked the blood supply, led to necrosis, which is the death of the soft tissue in my lip. So my lip required immediate medical attention. No doubt that if I hadn't have had that, I'd have lost my lip, but unfortunately it's not what is provided by the NHS at the moment. So as it stands, there's not really anywhere for people who have any of these treatments that go wrong to turn to. Only recently has the age limit been increased to 18, but there is no insurance body that backs the aesthetic industry at the moment. It's not compulsory for people who have experienced any malpractice where they can go to get any help. Essentially, the treatments can be carried out in any premises. It could be in somebody's house, it could be in a shed. There's no regulation around that really at the moment. There's no compulsory insurance, like I mentioned, and essentially we're talking about drugs that paralyse people's faces and drugs that can cause people to lose parts of their faces, and that's really what the concern we've got for me personally at the moment. Another area that I think is really key for us to look at is advertising. Cheap adverts on social platforms that are encouraging young and impressionable people to seek an instant change to their appearance. There's an added social pressure on young men and women to conform what is portrayed as the image of perfection. And often these individuals cannot afford the prices of qualified medical practitioners, and they do end up in the hands of people that may be more qualified. An industry that is becoming as common as having a haircut, but only the dangers aren't advertised as widely. And particularly for me, so training is imperative, that people who are delivering these treatments can demonstrate the acquired knowledge that they need to also be able to do that. Not only that, they're able to identify an issue much quicker, deal with it quicker, as was was it recommended in my case with one assessment from a doctor. It was very clear. Really importantly for me is regulate. Medical examination must be compulsory with a signed, agreed consent form. Advertising has got to be regulated to stop this easy promotion. And also we've got to regulate the cost. So by people choosing to have cheaper treatment, we need to have a regulated cost on that. But for me, the most important thing, I'll sort of end with this, is that we need to regulate these treatments and show evidence that people have got a medical background to be able to carry them out.
Thank you, that's really helpful. Thank you. If I move then on to Dawn Knight. Thank you, Dawn, and if you can keep your remarks to around 5 minutes, but please do take your time as well. I'm anxious that we get the full experiences in.
Yeah.
Dawn.
Thanks. I'm really gonna try my best to stick to the 5 minutes. So my name's Dawn Knight. I've campaigned for better patient safety regulation in both the UK and aesthetic industries for over 6 years now. I'm a lay trustee to the board of the GCCP, and I'm often described as an expert by experience. My message is really clear. It's safety. If we have safe practitioners, safe product, safe premises, then we will have safe patients. Choosing to have an aesthetic procedure is an individual's right, but it's also their right to be treated by an appropriately qualified, safe, ethical professional that can not only advise the right course of treatment or not if that is the case, but that they also have the right knowledge and skill to deal with any side effect or complication that should occur. I know only too well from personal experience the devastation that is caused when none of those things are in place. These treatments carry serious risk to a patient's physical and mental health, and they need regulating. But the culture that we've created around them means many seeking these treatments don't realise the consequences. For example, dermal fillers that go wrong, necrosis, sepsis, and even leading to blindness. I'm not anti-aesthetics, but sadly the lack of regulation and robust management of the aesthetic industry has led to extremes in both skills and ethical practice, allowing a monster to materialise. And that monster is at times stalking the blissfully unaware public. Anyone from a beauty therapist to a bricklayer can jump on the so-called lucrative injectable bandwagon. We've allowed a culture to grow in the UK where your dog groomer can administer your filler, they can buy it off Amazon, and they can whack it in. We have an industry that's riddled with people that simply don't know what they don't know, and the false sense of confidence is terrifying. Most people today will look for a procedure by asking a friend and going on social media, and oh boy, if you search it, your newsfeed is inundated with ads. Lots of these ads include illegal advertising, false and misleading claims, and enticements for both treatment and training courses out there today. I've challenged Facebook over this. No wonder it's a minefield for the public. In the case of a lay person that shows skills or an aptitude to inject, the most significant objections to allowing them to do so are very simple. There is no accountability or consequence. Get sued, they declare themselves bankrupt, start again. The patient claims on their insurance, if they have any, and the insurer refuses to pay out because in the fine print, they don't cover medical complications and they were never insured as a medical professional in the first place. Found to be negligent, it's fine, because there's no governing body to say we're taking your license to practice away. In the UK, anyone can inject anyone. Yet if you call yourself a veterinary surgeon and start injecting animals, you could land yourself in court. How is it that Britain is the only country in the Western world that seems to think, other than a healthcare professional injecting another human, it's acceptable? The UK aesthetic industry doesn't lack the will or the expertise, but it cannot self-regulate. The voluntary register system simply doesn't work. Shockingly, there are no legal requirements for anyone to obtain or meet a nationally accepted standard. If you're a healthcare professional, you'll have some relevant knowledge from your initial qualification, but many add on 2 or 3 day building blocks to access the aesthetic industry. Even with this additional education, there's no uniformity or guarantee of competence. Everyone requires additional learning. Let's have one nationally recognised standard. There is no single stream to report when a treatment goes wrong, no requirement to be trained or insured. There's a cost and often a lack of knowledge in the NHS when presented with an aesthetic complication. There's no additional support for patients. There are no guarantees of skills and competency. This can be an incredibly distressing time for patients with nowhere to turn. I'm going to end with the lid is well and truly off the aesthetics Pandora's box. It's a mess, and here's how we start to fix it. An aesthetic regulator, one centralised register with mandatory registration, funded by registration fees, relevant insurance, registration of premises, including an inspection, which could provide a revenue stream to local authorities, one nationally accepted standard of education and a register for training providers, a national reporting scheme, dermal fillers to become a prescription-only device. This would instantly reduce the risk to the public, track the products, address advertising, and deal with the misinformation. Strict enforceable rules on cosmetic advertising online. Prescriptions for non-healthcare professionals for aesthetic purposes banned. As there's been imposed on pharmacists by their councils, there are some that are unfortunately playing fast and loose with their prescription pads, writing prescriptions for third parties they don't know. How on earth can they give medical oversight? Believe it or not, most of these solutions have already been built. They're there and they're ready and waiting to go. Some incredibly experienced people have worked for free to try and clean this mess up. They just need some backing. Now is the time for the government to listen, to reason, and not be guided only by economics, but by patient safety. Safe patients, safe premises, safe products, safe people. Thanks for listening.
Thank you very much, Dawn. I've just seen half of Caroline Harris's head pop up on the screen. Okay. Caroline, just your camera a bit. Can you hear me, Caroline? We can only see half of you. No, she's not. No. Thank you very much. If we now move on to Siobhan Fallon. We've got Siobhan here.
She's not coming anymore, Judith.
Oh, she's not coming anymore. If we move on to Michael, Dr. Michael Aiken, please.
Hi there. Hi, guys.
Hi, Michael.
So a little bit about myself, first of all. My name is Michael Aiken. I'm a GP working in central London, and I'm also an aesthetics practitioner. I graduated medical school in 2006, and I began doing aesthetics in 2007. So I've been doing that now for about 13 years. I got involved, initially I was just training doctors, dentists and nurses, but around 2016 I was contacted by a few different non-medic groups, including beauty therapists, who had informed me that some insurance companies were starting to cover them for being trained in aesthetics. Initially, I was a bit surprised, but whenever I looked into it and spoke to the insurance companies, it appeared that they actually were, in my opinion, doing things quite carefully. They had assessed the risk, which is, of course, the insurance company's main job, is to assess risk. And they had decided that whereas a doctor, dentist, or nurse could do the course in 1 day, for Botox and fillers, that is, they said that beauty therapists at the time had to do it in 2 days, and it's since then become 4 days. So my opinion was, yes, these groups of professionals, although there may be a different starting point, I do believe that with extra training time being put into them and a bit of extra hand holding while they go through the process, I believe that they can be trained in all of the things that they need to know to the same level as most other medics. So to be clear, that doesn't mean that they can do surgery if needed, but it does mean they could, for example, administer Hyalase, which is one of the main emergency drugs that needs to be given in someone who has a dermal filler complication, such as vascular necrosis, which Rachel referred to about her lip. And thank you, by the way, Rachel and Dawn as well, for your stories. They're very interesting, and everything you've said, I think pretty much everything you've said, I completely agree with. All the things that you've listed, the regulation that's needed in the industry, I agree with all of that. I believe that a register is important. I've been asked to answer questions that are on the summary sheet, so just very quickly, basically assessments of patients, statistics on when things go wrong, a reporting mechanism for when things go wrong, a basic level of training, and regulation of premises. All of that should, I believe, be covered by an aesthetics register. The issue with existing registers that exist or exist in part currently are that currently they seem to prioritize discrediting certain non-medical groups rather than prioritizing patient safety, in my opinion. And there's a bit of a logical fallacy, I believe, that they're kind of saying that some professional groups aren't educated enough to be educated. So that's like saying you don't know enough for us to teach you, which is a bit of a logical fallacy, because of course, as a doctor, before I went to medical school, I wasn't a doctor. I had to learn to become a doctor. So in the same way, I think with Botox and fillers, everything can be taught that needs to be taught. As a GP, so as a practicing doctor, if I get a patient who had a vascular necrosis, I would administer Hyalase and follow the protocol. But if the patient didn't respond to the protocol, I would be referring the patient to the closest A&E department that had a plastic surgeon, just in the same way that a beauty therapist might. So obviously it's important. The difference is that I know to do that. And if someone wasn't trained correctly, they might not know how to do that, and that would be wrong. But I think it is possible, entirely possible, to train non-medics to a certain level, as long as we have strict criteria and strict guidelines to what the pass-fail criteria is, and we have strict criteria as to how they'll be appraised each year to keep up with that. And I think a register is a perfect way of doing that, and it should follow a similar setup to how things like the General Medical Council registers their doctors. So for example, I have a yearly appraisal where I have to go through all of that kind of stuff, demonstrating my knowledge, demonstrating my certification, and my ability to do my job. So yeah, I think that's everything I want to say. I agree with you guys. I think this is something we can do well, and I think it's definitely needed, and I'm ready to be involved in whatever way I can. So that's me. Thank you.
Thank you very much, Michael. And if I can now welcome Chris Wade. Chris, you've got around 5 minutes. Please, the floor's yours. Thank you.
Thank you very much. I'm Chris Wade. I am the owner of A Training in Grantham. I was part of the Bruce Keogh report in 2013 and have championed since 2013 for qualifications within this industry. For me, the sector requires a qualification that's regulated, and whether you're a medic or a non-medic, we've produced over 100,000 different treatments over kind of a 10, 11-year period. And in that time, there has been complications, but at the same time, I do believe with the correct training, the correct skill set, the correct monitoring, and the correct supervision, that there is the ability to correct. And I think the important part is that the underpinning knowledge is that the procedure is done in the correct environment. We have the correct backup, the correct skill, qualification, training, insurance. And for me, from the public, especially as social media grows, you know, I've got a 9-year-old niece that recently came to visit me and said, "Uncle Chris, can I have lip filler?" You know, this is kind of out there, so I agree change has to occur. But when it comes to regulation, I think it's important to understand now that products are going to be available and the market is open and wide open with the internet. So from a voluntary kind of perspective and a voluntary self-regulation, I believe that without dogma that we should have a cross-reference that it's on skill set, qualification, And there is already available a level 7 qualification for medics and non-medics that I took part in that is regulated by Ofqual. And I think from that point and the correct training and skill set and insurance and the environment with a register, and I would like to see people carrying a card that's connected to register with ID, and specifically aesthetic practitioner medical trained or aesthetic practitioner non-medical trained, and then it's down to the choice from the consumer which person they choose to have the treatment with, but they still need to have a thorough underpinning knowledge, skill set, qualification, insurance, and able to prove that they are part of a register. And that register needs to be across the board and available to all people who've trained following, and as long as they tick a certain criteria and they follow training. So that's kind of where I sit, and you know, I want to be involved very much so. But I think it's really important that, as Dr. Michael said, that, you know, I'm a qualified teacher, training, you know, I followed a pathway, and someone can be trained and a skill set can be given with correct training and competent level. That's important, and as what's just been shown with COVID-19, as much as healthcare practitioners play a very important part, I've trained medics, non-medics, I'm part of a very good group. I've got supervision, and I welcome supervision, and all of our kind of prescribers, non-medical, and prescribers and supervision are involved. But at the same time, to bring people away from the very important playing part of being in A&E, being in a hospital, you know, as an NHS healthcare practitioner, to then take them away from that into clinic full time and to be delivering aesthetic treatments, I'm sure there's going to be a lot more problems if these people were manoeuvring away in a pathway into an aesthetic world away from a full-time healthcare practitioner. But I do feel that we need both, and there is a need for both, with a clear directive and a clear doing what it says in the tin. As aesthetic practitioner non-medical, aesthetic practitioner medical, with a register, insurance, and a qualification that's regulated by Ofqual. That's kind of where I sit and champion my part on it.
Thank you very much, Chris. Thank you, that's very helpful. Now I'm going to open it up to questions from all parliamentarians. So far we've got Nick Smith, John McNally, Alberto Costa and Caroline Harris here. But before I open it up to everybody else, can I just start off, and it's a question primarily to Dawn and Siobhan, which is drawing on your experience really of when things have gone wrong. Is there a reporting mechanism in place for patients who've suffered malpractice? And what support is given to patients that have experienced complications following following treatment? And what would you, importantly, if what is in place now is not sufficient, what would you like to see in place as an experience from your treatment? If I can start off with Dawn then, please.
Yeah, I mean, there are a few places that you would be able to go, such as, you know, the JCCP if the complications caused by one of their registrants or one of the professional councils. You know, if it's a GMC doctor that's caused a problem, you could report to them. I think the biggest problem is that there is no specific one place that the public can go, and we have massive issues, I'm pretty sure everybody would agree, with regards to collecting the data as well. So to me it would kind of make sense to have one overarching regulator that would be able to take the complaint, direct that individual to whatever pathway would be suitable to make them supported, to help to support them, but also to capture the data to feed that back into the industry. Obviously there's Save Face as well, and Safety and Beauty, you know, all doing an amazing job to try and support members of the public. It really is quite a life devastating time when you enter into something that you later turns out to be not what you thought it was, or, you know, you weren't in the hands of someone who could swiftly, and sometimes in these cases it does need swift action, deal with the medical complications that you're faced with. So, you know, in my opinion, the overarching aesthetic regulator and a register that can offer support, a tribunal process, redress, but also, you know, some support for the practitioners out there as well. You know, they don't take lightly causing an injury to someone, not ethical practitioners anyway. You know, it's a really big concern for them. So I think now is the time. I think we're all, you know, whichever direction you're coming at this from, I think we are in agreement that things need to be moved forward now.
Thank you. And in the hazards of stepping into chair last minute, can I ask Rachel Knappier to give her answer, and then we'll go back to Helen McGuiness, with apologies, Helen. Rachel.
Oh, sorry, Judith. Rachel's having a few problems logging back into Zoom. So if you
the hazards of last minute chairing and technology. Helen, what a fantastic point for you to come in. I can't hear Helen.
I can't hear anything.
Helen, we can't hear you. Right. Perhaps we can come back to that. I can see some technological assistance coming up with in Helen's house, I think, with an arm coming in. Helen, we'll just hang on for you for a bit until you try and get that sorted out. Helen? No, we can't hear you. Carry on working. We can always come back to you, Helen. Don't worry. And I'm opening it up for questions now. I've got a question that Nick Smith sent in. If I can start off with that, and then if people indicate that they want to come in, that'd be great. And the question from Nick is, how big... Nick's not here anymore, are you, Nick?
Yes, I'm here now.
Oh, right. You're back. Okay, there you are, Nick.
Sorry, Judith, I was doing some other busy work. Can we thank the contributors for their contributions, please? So my question is that data one really, how big is the problem, and how good is the data that records the different complications that may have occurred? Is the health service or local health boards good at understanding this issue?
No, I don't think so. I believe that there's some data. Can you hear me okay?
Yeah.
I believe there's some data being collected by some small groups, but I don't think it represents the whole industry very well, because it's not mandatory to report anything. Like, a complication isn't mandatory, and also patients don't necessarily know where to report it to. And then also there's a bit of bias with the reporting from some of the small groups that are reporting it. So, for example, they have an agenda that I mentioned during my presentation. They have an agenda to outlaw certain non-medic groups, for example, so they'll lump them together with people who have never been trained at all. So I think, you know, a proper unified aesthetics register that was mandatory would mean that we could start to collect that data for the first time.
Thank you. Would anybody else like to give a view on that?
Yeah.
Open up the panel.
If you don't mind.
Yeah, go on.
Yeah. I think the other significant thing to bear in mind is that I have met with 3 previous health ministers on this, is that often the first thing the government will say is, well, show me the data. And it's a huge black hole, really. There are lots of individual organisations collecting their own data, and sometimes they're a little bit precious over sharing that or how it's shared. Also, if you present to A&E, at the moment there is no way of a doctor that meets you at A&E really capturing that data and feeding that back, you know, to try and improve the complications or identify areas of concern. So I think the data capturing really and mandatory reporting of adverse events as well. I agree with Michael. You know, the systems there, the yellow card systems there, but there are not many outside of the medical sphere that would even know that that exists.
Yeah.
So the data capturing is a big issue.
Yeah, and as soon as we start to measure what's going wrong, then we can implement what extra training is needed for different professional groups. So at this point, we can only guess.
Thank you. Nick, do you want to come up with that, follow up on that?
Yeah, and perhaps Michael could help. Is there a doctors or a medical group that would be interested in gathering the data, or maybe which, as a consumer group, be interested in a further study to try and provide some transparency and encourage people to come forward and to better enumerate this devastating issue for the individuals, of course, but what sounds to be a much bigger global issue.
Chris and I.
We're presently nearly ready to launch. Dr. Michael Aiken is going to be the chairman of the Association of Aesthetic Practitioners. So from a medic and non-medic kind of point of view, we're in the process of putting together a kind of a self-regulatory register. So we would be open and receptive and happy in the over 100,000 kind of treatments that I've been involved with from training and the practitioners that have trained. We presently have had 9 complications, 5 non-medic, 4 medic, and on the percentage of those within 72 hours, all of them were rectified, thankfully, with the supervision of being a healthcare practitioner as a prescriber, whether it be, hyalase, antibiotics, or steroidal intervention or a combination. I think it's important that while we look at the statistics, we also look at the kind of the other aspect of the growth, the high street, the people, the very good kind of practitioners that are out there that are doing a great job. And I think whilst collecting data is really important and involvement of these issues, which is really on the increase with the fact of the lack of training and the half-day training and the products being available over the internet without any kind of intervention and question whether they're insured or they've got any training. So, I do think it does come down to the fact that no one should be delivering a treatment without actually having access and supervision and a thorough qualification and insurance.
Yeah, just further to that, I see someone else has asked, would the ACE group not have some data? And I think that's correct. The ACE group and also Save Face and also the JCCP would all have some data. The issue is that the practitioners who are reporting their complications, in some ways, they're not the ones that we should be worried about. It's the people who are, practicing in secret and private and not telling anyone about it, maybe practicing without a supervision of a medical practitioner in the background. They're the ones we should be worried about, and that's why this register should be mandatory. At the minute, we can only, the issue is we need to put in a lot of work to set up a register like this, and a lot of that will possibly be done without funding. And unless it's mandatory, we can only expect to get a very small uptake. And the uptake, as I've said, will be people who we don't really need to worry about as much. So it kind of is a little bit counterintuitive unless we can get some sort of mandatory push that people should be on a register.
Mm-hmm.
Are there any other questions on this subject? Oh, sorry, Dawn, did you want to come in?
I was just going to say I would agree with what they just said. The only concern for me would be that the source the government would look to gather the data. It would need to be independent or training. And I just think that if we
I think
there's lots of questions, but
we recognise the need for everyone to be involved. So definitely all of the major training schools who are training non-medics definitely need to be involved in this. and it needs to be run properly, proper board, proper abilities to remove people from the board and add people to the board. All of that. We want to do it right. I know that aesthetic practitioners that I've trained, the main thing is they don't want to see someone get rich out of a register. They want the registry to be for patient safety, and they're not going to buy into it if somebody at the top is going to be making lots of money out of it. That's what I've seen, and that's what we want to provide.
Okay. Any other questions on that specific topic? Anybody? Any parliamentarians?
Can you hear me now?
We can hear you, Helen.
Yes, you can hear me.
We're delighted to hear you. Welcome.
Can you see me?
We can hear you and we can see you, and we're really looking forward to hearing your evidence.
Okay. Hi, I'm Helen McGuiness. I'm principal of the Helen McGuiness Aesthetic and Beauty Training International. I'm based in Southampton in Hampshire, and I set this up in 1992. I run a range of professional training courses in beauty, therapy and aesthetic skincare to both individuals, salons, spas, both nationally and internationally. So I've had over 38 years experience in the beauty industry, and one of the main reasons I've stayed in this industry for so long is I've always had a lifetime passion of making clients feel better about themselves. So 10 years ago, I started my journey of developing my existing beauty therapy skills into offering some more advanced aesthetic or skin rejuvenation treatments, such as chemical peels, mesotherapy and microneedling. And then I progressed on to aesthetic training in injectables, botulinum toxin, dermal fillers, which are classed as non-surgical cosmetic procedures. So regarding training standards for beauty practitioners, it does seem to vary considerably, with some courses just consisting of a few days training. And I've seen some foundation dermal filler training, for instance, that's just one day. So speaking from my own experience, I researched my training very carefully, and I'm fortunate to say that my aesthetic training in both botulinum toxin and dermal fillers was very comprehensive, with Chris a training in Grantham. The entrance requirements were a minimum of a level 4 qualification, which in my industry is an advanced level award. The training was undertaken over a period of a year and consisted of 14 days face-to-face training, considerable home study, and 4 clinical assessment days. I also completed training in first aid, anaphylaxis, and also managing complications. I'm currently working towards my Qualify Level 5 and 7 in aesthetic practice, which is a new qualification which became available in October 2019. This is a significant qualification, as it's the only Ofqual regulated qualification open to both medics and non-medics. And in order to achieve this qualification, I've had to complete several assignments, and once lockdown is over, I'll need to complete several practical assessments to prove my competency before I'm certificated. So I'll try and make this brief because I know we're running out of time, but a little about my own experience as an aesthetics practitioner. Since I've qualified, I've been building up my own part-time aesthetics and cosmetic clinic, which I run in addition to my training school. And I practice dermal fillers, Botox, chemical peels, microneedling, mesotherapy, to name but a few. The focus of my work is very much on natural enhancements, or as they're often referred to, tweakments, and most of my clients are over 40. My experience of carrying out the treatments is largely very positive, and I absolutely love the work I do. I'm very serious about standards, especially being a trainer, and I'm always looking at ways in which I can raise the bar. I work to a set of national occupational standards, and I also am under the supervision of an independent prescriber for the administration of botulinum toxin injections. And a lot of my aesthetic clinics in my geographical area are doctor or nurse led. And as a non-medic, I have experienced some discrimination from some medics against me offering injectables,
which is probably down to the fact that it's a well-known belief by some medics that beauty professionals should not be allowed to administer injectables because they don't know how to recognise and deal with complications. But it's my belief that if a practitioner is well trained, then it's irrelevant what their background is. What's needed is a level playing field for medics and non-medics, and for people to be treated safely and effectively. Just quickly about my own experience of client consultations. When clients come into clinic, they have a full consultation, they're checked for their medical suitability. They have to sign a full consent form, which is several pages long, which outlines their risks and complications. And I also give clients a cooling off period where they can consider the procedure and whether it's suitable for them. If clients are wanting botulinum toxin, they also have to have a health care check with face-to-face with the independent prescriber, because it's obviously a prescription-only medicine. And they also need to be assessed manually and visually to really assess what's realistic and what's achievable for that particular client. I think there's been probably enough said about the complications, so I'll kind of, I won't say too much, but obviously there are some short-term and more serious complications, and I think they should all be outlined to a client in their consent forms. But I will finish by saying that my feeling really is that client safety and communicating with clients about their complications is really important. And I was taught really to respond to clients very, very quickly regarding if anything goes wrong. So I always encourage my clients to have a review after their treatment, and for them to always contact me in the event of a problem. And I think we need to keep that communication channel open. So I'm sorry in the case of Rachel and also in Dawn that you had those unfortunate experiences. And I agree with Chris and Michael in that there needs to be a centralised register that's open to both medics and non-medics, and people should be judged on their merit and their qualifications, not necessarily if they're a medic or a non-medic. Sorry, I hope I haven't overstepped my time.
No, you haven't, Helen, and thank you very much for bearing with us and being so patient. Yeah, thank you very much.
Thank you.
I've now got some questions. I had Alberta indicating that we wanted to ask a question. Alberta, the floor's yours.
Good afternoon, and thank you, Judith, for chairing this meeting. My own involvement started a number of years ago. I don't think Rachel's on the call anymore. I think she was having some difficulty. But Rachel first approached me, and back in the, I think it was the 2015 Parliament, I first raised this whole issue before this APPG group was formed. What I would like to ask is, really it's a question that I had for Rachel, Siobhan and Dawn, but the question I've got is, are we able to understand why people consider having these forms of non-surgical cosmetic procedures? What is the primary factor that led, for example, you, Dawn, to consider having cosmetic procedure? Is it peer pressure? Is it social media? Is it a mixture? Is it just your own self-esteem? Why do people choose this form of procedure?
I think everybody's journey is very individual to them. So I'd lost quite a lot of weight, and it was my hooded upper eyelids that bothered me, but I've had aesthetic treatments for many, many years prior and since. I do think that depending on what generation you're necessarily talking about, the peer pressure and social media do play a huge part. But then I think also, you know, maybe for people of my sort of age group, it's more about that feeling of well-being. You know, I don't want to look 21 again. I'm not going to be 21 again. But it's become a part of people's sort of care regime. I think the worry is that the hysteria sometimes that's caused through social media and certain TV programs and that sort of thing kind of waters down the seriousness of some of the treatments that people are entering into without really considering, yes, the effects when things go wrong, but then also there are things like the ongoing financial commitment and that sort of thing. I mean, I teach students 18 to early 20s, and when I hear them talking about going to a Botox party or a filler party, the hairs on the back of my neck stand up. It's how do we begin to shut down the white noise, which is undoubtedly driven by social media and really doesn't do anybody that's trying to do a good job and be ethical any favors at all, and really begin to bring the industry together and raise the bar. But ultimately, I will always go back to keeping the public safe. What are we doing?
Yeah. Judith, can I ask a question?
Of course, Carolyn, you are the next parliamentarian on my list.
Thank you. I just wanted to know, so I firstly apologise for being late, but I was in the chamber because the Prime Minister's has just announced hairdressers can open. Regardless of whether you're medical or in the beauty side of things, I'm really concerned about what kind of psychological assessments are done before anybody has any treatment. It worries me that, I think Alberto's question was very poignant, that why do people need to do this? Does anybody do any formal psychological assessments? I know, Helen, you talked about a cooling off period, but you know, do you follow any sort of set guidelines to say, ask specific questions which would highlight why somebody's doing this, or if there may be, I'm referring to body dysmorphia here. Yes. Some people, I feel, will never ever be satisfied no matter what they have done or who does it, but I'm really interested in that part.
And who's that question to Dawn?
Anyone, any practitioner, anyone who's experienced.
I can answer that question if no one else does. I think body dysmorphia, it's something that should be taught in every course. There's not a lot to it in terms of screening. I mean, body dysmorphia is where somebody believes they have something that they don't have. For example, I had a patient who came to me and they said, or they want something that doesn't make sense. So for example, I had a patient who said they wanted their cheeks to be bigger. And then whenever I explained the procedure, they said, no, I want my cheeks to be smaller. And I said, well, you can't, obviously your cheeks can't be bigger and smaller. And they said, no, that's what I want. So that became very obvious. That was something that was completely unrealistic. So that was my experience of body dysmorphia, but that's the only time I've experienced it in the 13
Michael, do you actually do any kind of psychological assessment of potential patients as to why they want to have this done?
Well, it would be completely typical and impossible to go ahead with treatment without discussing what they want. So I suppose the fact that I know what it is and the symptoms of it, I would recognize that as part of the assessment. I mean, there's a medical history form as well, so we would ask people if they have any medical problems, but this is assuming they slipped through the net and they haven't been diagnosed. That's the point I would recognize it when they're asking for something that's unreasonable. But as I say, everyone should be aware of what body dysmorphia is, who's offering these treatments.
But I'm not just talking, I mean, body dysmorphia is one aspect of it, but I'm really concerned as to what kind of insight you have of that person, client, patient, whatever, about what is driving their motives. Like, I get what you say, Dawn, on the losing weight, but if it's something that isn't necessarily quite obvious that you need done, and then it sets off a whole chain of people having one treatment after the other, after the other, after the other. You know, at what point would somebody say, well, enough's enough? So
yeah, well, I suppose that body dysmorphia would be an actual illness, whereas a lot of this industry is it's a bit subjective, because it is somewhere between the medical industry and the beauty industry. So, you know, I say to all my patients, you know, say somebody wants their lips done, they say, do you think I need my lips done? I say, well, nobody needs their lips done. It's aesthetics. It's if you want them done. And then within that, there's certain parameters. So I have my own limits. I wouldn't make them beyond a certain amount of volume, things like that. But so body dysmorphia would be a separate category because it's very extreme. It's an actual illness.
Yeah, but that's what I mean. That's just one thing. I'm really worried about. I think Fiona's just given me an answer I was looking for in the chat box. In that, yes, you do it, Fiona.
Sorry, yes, we started using the there's a BDD questionnaire and there's an appearance anxiety questionnaire, and you can actually get someone to fill it in online, so it doesn't save, it just gives you a score, and then you can pick out the ones that are going to be more problematic or maybe need psychological referral. And we were having difficulty getting the reception staff to get people to fill this in on the app. So we've designed it in a paper format. So it's not completely the same, but it's still, it has more questions in, but it gives us an idea of who we do. Because the other thing is about the body dysmorphia is if you've got people who are borderline body dysmorphic, they're going to cause much more problems in terms of complaints and complications, and they're just going to cause you more of a hassle. So it's in your own interests to screen, do some sort of psychological screening. So that's what we do.
Did you have one done, Dawn?
Yeah, when I had my gastric band done, actually I did have a really in-depth, it was like a mental health medical screening. I would say though, it's one thing thinking that you can recognize someone with a body image issue, and it isn't always body dysmorphia. Sometimes it's self-harming, sometimes there are other things that have driven them to walk through the door. The thing is do you know where to signpost that individual? And it might not necessarily mean that they shouldn't have the treatment, but they need a supported journey. And I know that some of the medical councils have made it sort of mandatory that their members do a mental health screening as part of their consultation process. But unfortunately, again, Carolyn, it comes back to the lack of regulation in the industry and the lack of continuity, where some will and some won't. Some don't think they should. Some should and decide not to. So
I would be terrified to think that somebody could walk into a salon this afternoon and say, I want to have X done, and nobody's going to, and they'll have an appointment straight away to have something done without anybody have done any kind of backup, any kind of work around it. They would have just give the treatment, whether they're medically trained or whether they are a beauty therapist. That really worries me. Helen, do you do any kind of assessment?
Yes, I do. If I feel someone's at risk, as I think it was Fiona said, there is an assessment tool that you can use online. And red flags to me would be somebody that's I always ask them, what are they looking to achieve? And I even get the mirror out and ask them to point to areas and be very specific and ask them what their reasons are. And red flags to me would be somebody that was, say, looking to improve a relationship or do it for somebody else, or, if they kept coming back for more and more. I mean, my concerns, which I didn't go on to say, were about under 18s, because I have been approached by a number of under 18s for lip fillers, and I simply have refused. And I had one young girl who had, I can only estimate, must have been about 4 mils of filler in her lips, and she wanted more. And I just declined it on the basis of safety, because I said it's just not safe to have that amount of filler in your lips. But obviously she'd had it done somewhere. Another red flag to me would be a client hopper, somebody that goes from one clinic to another and then gets, because I'm always very suspicious. I've had people come in, and that's why I said I do a manual assessment, because I want to feel what's inside their skin, because they've sat there and blatantly lied to me. And I've said, look, have you had dermal fillers before? And they've said no. And it's patently obvious when you're trained in it, you know what you're looking for. And those type of clients are the ones that I would shy away from, because a client with at risk of body dysmorphia is going to be a huge problem, because they're never going to be satisfied.
We talk about
and they're vulnerable.
We talk about bad clients. What about bad practitioners? What about the ones who don't do this, and the ones who are happy to do multiple multiple treatments, or the ones who are prepared to do them at a drop of a hat, or the ones who don't, you know, it's good. There's good and bad in all this, whether they are whether they're beauty therapists or whether they're medical trained.
Can I ask? I mean, in terms of a red flag, wouldn't a red flag be just that kind of almost addictive nature of just having procedure after procedure after procedure?
Definitely.
And do all practitioners look for that?
Yeah.
Yes.
Yeah.
Okay. It's all gone very quiet now.
Sorry, right. So everybody everybody here would agree that that's the way forward, is there has to be some kind of assessment.
I think it's, yeah, definitely. Can I just speak? Sorry.
Go ahead.
Michael.
Chris, yeah.
Oh, was it Chris? It's very difficult sharing this by Zoom.
As part of the level 7 qualification, which was very informative to myself, because obviously as part of my training originally, you know, there was no training about body dysmorphia, there was no training about mental health issues. So as part of the qualification, there's assignment and assessments that really look in depth to that, and we invite body dysmorphia kind of experts onto it. And I do think it's important now to develop a tool. You know, I don't think there's anything available across the board, and I think it's something that definitely is a tool that would be welcomed. And although we do training as part of our assessment in the qualification, and we do recommend tools, and we have got questionnaires, I think it's kind of very difficult because these people who generally have these conditions are very good at being able to hide them, and also they will very much move on to the next practitioner as you sense that they sense you won't do the treatment. So the ethical practitioners are potentially the ones that are well trained, that understand, that will say no and are insured and doing it clinically. And I think for me, it's making them potentially available on this register where they're known, and really being able to very quickly see the ones that aren't, and then those can be dealt with and removed. I think it's very, very much now at the moment, it's a quagmire and it's very difficult needle in a haystack. But I think the beginning parts is to look at a potential tool across the board and then bring it towards training. It's part of our qualification.
Do you include this kind of psychological assessment in your training package?
Yes, yeah.
Helen, do you include it in your training package?
Well, I don't actually train people in injectables, but it would be something that I would definitely suggest.
It's probably something that should be included in any cosmetic training, whether it's non-injectables or anything, permanent makeup, laser. I would have imagined it should be in everything. So it's another benefit potentially of having a mandatory register. We can all agree certain standards for assessment, and that could be another one of them.
I mean, this group hasn't decided yet whether we're in favour of a register of registration. We're still at that exploration stage. We're trying to build up a picture of what we feel the sector should look like and how the sector should behave. Because one thing that struck me is what a nasty arena it is. I am absolutely shocked at the vitriol. I mean, I've done a lot of work on gambling, and I thought the bookies were bad, but boy, the beauty industry takes some beating when it comes to people actually trying to make sure their point of view is the only one that matters. Says I, who loves to hear the sound of her own voice. Sorry, Judith. I know we need to move on to the next bit, don't we?
We do. I'm sorry that we're out of time for this session because we have overrun slightly. But we have got, following on from this, another session which Caroline Harris, my co-chair, is now going to chair. So I'll hand over to her. Caroline Harris, you have the floor.
Thank you very much. This is what I like. Apologies. Okay, so this is a bit of an extra that we added in, and this is a result of work that Judith and I have been doing over the last couple of months last couple of weeks since COVID, around being really concerned about clinics and hairdressers and everybody else that may have been operating illegally during the COVID lockdown. And it was something which I think we've had stories in quite a lot of the newspapers. And on Saturday night, I had an email from Fiona, who is, as we know, a practitioner. And Fiona, if you could share with us the kind of experience you've had over the last few weeks. I think it's something we as a group really need to make a firm stance on, regardless of what have happened in announcements today, because there's nothing in today's announcements which will make the kinds of treatment that we are really concerned about happening. They should not be happening. So I'm going to hand over to you, Fiona, to give us an idea of the background.
Okay, thank you. I've been seconded to microbiology during the COVID, so I've not done any aesthetics at all, and I've been sort of detached from it. But I discovered an advert for a nearby clinic announcing that it was open. This was last week, and it had been open since, or it was from the 11th of June. We are allowed to open again. And when I questioned this on one of the aesthetic Facebook forums, they said, well, we're doctors, you know, the consensus was we're doctors, we can open, we were never subject to lockdown. And it turns out, because of the British College of Aesthetic Medicine, who have sought a legal opinion on the business about what constitutes medical procedures. So medical procedures, as we know, as everyone accepts, were never subject to lockdown. These doctors, who should know better, are saying that all their aesthetics is medical because it's all prescription only medication, and therefore they were never subject to lockdown. And they're quite adamant about this. I've argued on Facebook, and I've experienced the vitriol that Carolyn was referring to. So I've just stopped looking at it now. But what disturbs me is that you have well publicised government guidelines that are there to protect the public, that are there to reduce the transmission of this virus, to reduce the number of cases, to protect the NHS workers, protect the public. And you've got this group of aesthetic doctors who their thought is, how can we get around this so that we can carry on with our lucrative practices? And they've actually gone to the trouble of finding a way around this. And I think that's hugely disturbing. Now, the way they've got it around to say that it is medical is because of the license for the Botoxes, really, which one of you've got medical indications for Botox, and then you have for the improvement of facial lines, where these have a severe psychological impact. So now you have these doctors calling their treatments medical because of the severe psychological impact. Now, if someone is so psychologically impacted by their facial lines that they cannot postpone their treatment for 3 months until after the pandemic, then the question is, should we be treating them at all?
To be in a psychiatric unit.
Exactly. So from all points, that they've got no argument, and I'm absolutely disgusted that there are doctors who are out there who've been working throughout, who are blatant. The clinic I was talking about, I asked my daughter to message them and see if she could get an appointment for lip filler. She's 21. She messaged them. I said to say that you want it as soon as possible because you wanted your lips to settle before you go back to work. So I told her what to say. Message came straight back, yes, we can treat you this afternoon at 3 o'clock. Now, there's no way on God's earth that putting lip filler in a 21-year-old is a medical essential. And this point seems to have completely bypassed these aesthetic doctors, and I think vast majority of them, sadly, are doctors, that, you know, it's medical essential procedures continue and not things that can be postponed. And there's lots of guidance which I've sent to Carolyn regarding this from all bodies. Everybody else in the NHS, all the Royal Colleges, everybody produced guidelines about what was essential, what wasn't essential. This is how you do things. And the only group that I can see who've carried on regardless are the aesthetic doctors.
Well, I don't know if that's right. I mean, has anyone heard of any clinics, non-medical clinics who are still practicing, because we've certainly heard whispers that as long as they are able to say they are medical, in that they have a nurse on site, that they are finding a loophole in the actual regulations. We did write to the Minister about this, but we were told that it was an unfortunate consequence of the regulations, but it was up to the local trading standards to police it. Now, trading standards are under quite a lot of pressure. I personally, I don't think that's right, and I think as a group we really need to push this agenda, and certainly now that we've got the evidence which Fiona kindly give me. Dawn, I can see you were indicating.
Yeah, well, what I was going to say, in a way, this really does, if it was ever needed, throw into sharp focus the need for some definitive regulations in black and white that can only be interpreted in one way. And obviously, you know, COVID has really brought that to the fore. I have to say, Radio 4 did a piece on this with BCAM, and they did have a lady on there who had gone back to her beauty therapist and pestered her, and she had her treatment done during lockdown as well. But again, it really, you know, we can't enforce it enough. We don't know who are doing these treatments across the country. We don't know where they are. We don't know who they're treating. We don't know what they're using. We can't possibly carry on like this. The risks are huge.
So, Michael, can I ask you, as a medically trained doctor, how do you see us being able to tackle that issue of people who are currently practicing under COVID? I'm going to come to you then, Chris, if you could give me an answer.
Yes. Okay. Well, I guess it's a bit late now, but we potentially could be facing another wave of COVID or another pandemic at some point in the future. Hopefully not. But I think we need to look ahead. I think it's probably more important to look ahead than it is to try to look backwards, although I recognize that you might want to...
but currently they still shouldn't be practicing, so even now it's a relevant issue.
So I've actually been involved in a discussion. We have a private Facebook group with about 250 people who have been discussing this over the last few weeks, when we can start back in aesthetics. And there's a whole mix of people on there. So there's doctors, dentists, nurses, beauty therapists, and lots of other groups. And what people have really held on to is what we've done is we've risk assessed what's the most similar regulated profession.
Yeah.
What's the most similar to us in terms of risk, and we thought that maybe dental procedures that were non-emergency was the most similar. So we looked at the dentists, and initially they said 4th of July would be the starting back date for regular procedures, but then they suddenly changed it to the 8th of June. And I know a lot of practitioners were talking about using that as the date of going back. And to be clear, the letter came from the GDC. Somebody posted it with a link to the site, and it said that they were recommending that all dentists start back, not only for emergency treatments, but for all procedures, including routine procedures. So I know that would be a basis for a lot of people for starting back. That was the discussion. But again, as Dawn has said, ideally we would have a register that would be telling us this is the date you can start back after a discussion like that, but more formalised.
Well, in Wales, that's not right. The dentists are not operating back to normal in Wales.
Sorry, so that's England. Sorry, that's England.
Yeah, Judith, is that your understanding?
Well, I thought I'd seen something from the British Dental Association about that dentists were the only dentists that were allowed to start back were those that had the relevant equipment to be able to cope with the high pressure environment that you get from dental treatment and mouths to control the spray. So I don't think in fact I know they're not offering a full range of services, aren't dentists.
Well, can I just add?
Go on, Chris.
Hi. Well, I probably kind of cross over everything, because in the building that I am as part of my business, I've got a hair salon, a gym, and cosmetics, and a training, and right next door to me in the window is a dentist. So the dentist is open. So the dentist next door to me through the window is open presently and has been for about the last 2 weeks. Obviously, the hair has announced that they're open, so my ground floor will be opening, and the gym, which is the basement, will be opening. But the the first and second floor won't open. I think it's very difficult because there's not one clear directive. I don't think that we should open following the government kind of recommendation, but I do think that the message is quite diluted. I think because of what's happening with the doctors, people have messaged me for 6-7 weeks saying, two doors down from me, there's an aesthetic medical doctor that's opening because the CQC registered. I think it's a very difficult one, but I do feel at the end of the day, if the government states that we don't open, then we don't open. That's the directive. It would be nice for us to have a representation and be part of that with a panel of experts. But presently we're not opening.
Yeah, well, even after today, gyms are allowed to open, and gyms are not allowed to open unless they're outside. Inside gyms can't open, swimming pools can't open, spas can't open. The only thing that will really be opening is hairdressers and potentially nail bars when they've done another assessment after July the 4th.
Yes, which is very, very clear. However, as an aesthetics industry, I think we were moved into beauty where then medical openings. I think, now the message is becoming clear, and I think that's what the practitioners want. I know approximately 1 hour ago, I had about 100 messages from practitioners that so can we open, can we not open? So it's that very clear directive that they can't open.
Right. Okay. Dawn?
Just quickly, Carolyn, I think we did ask the Care Quality Commission and challenge them over doctors being able to open and claiming that the aesthetic procedures were in some way essential. And I believe the CQC's response was that during COVID, they wouldn't be able to the doctor's clinic whether they could open or not open.
Yeah. This is the point I was trying to make about the psychological assessment, and I think I must have asked 1,000 people. And that is, if someone has got a prescription, if someone has got doctor's advice that they have to have treatment, even in COVID, then they must have a really serious psychological problem. That other than that, they shouldn't be doing any kinds of treatment whatsoever. Judith, sorry.
I'm just looking at the advice. I can certainly share it with the group, and will share it with the group, which is the advice from the British Dental Association, which they say that barely 15% of dentists are in a position to offer a full range of treatment from the 8th of June. And that's because of, they need to have the sufficient equipment and PPE to do it safely.
So this and what you said about the Facebook, Michael, and the dreadful experience that Fiona has had comes down to the fact that some people, and these people will always do this, whether they're right or wrong, will interpret it, have and will continue to interpret guidelines to suit their own ends, and that's the bottom line. And I think this is where we really have to, as a group, force some kind of strong message from the government that this is a really dangerous and serious situation, because not only are we in a situation where professional medics may well be undertaking procedures without doing any kind of psychological assessment and so on and so forth. It is the very worst of the industry when people will do it. They'll have Botox parties, and we'll have kids injecting each other like we've seen before because they think it's the way to do it. So we have to use this time to really influence the report going forward to demonstrate that there is such confusion in this industry that it's led to the loopholes that we should never have had in the first place.
Yeah.
Caroline, did you want to say something?
I wanted to say that, this was discussed in Parliament, wasn't it, on Friday? There was a few questions raised, but I know the Minister said quite clearly what you said, it's medical conditions. If it's can be justified as a medical condition, but that is such a grey area and quite an open area.
Fiona?
So any other medical condition, you go to your GP and you get referred to secondary care.
Yeah.
If this was exactly the same, there'd be no question. And if you went to your GP and the GP didn't agree that it was medical, then it's cosmetic and it can wait. And that's just the simple answer. Put the same regulation into this as we already have in terms of a referral system.
Probably one second. It's probably opening another debate, but I think really there is call for actual the botulinum and dermal fillers to be classified on a secondary classification of prescription for non-medical procedures that then could be deemed to be separate, but as still prescription-only medicine. I think that's for me the way forward. I'm a fan of dermal fillers becoming a prescription-only medicine, but I think it should be classified as a non-medical procedure prescription-only medicine, as well as a botulinum toxin if it's being used as an aesthetic treatment rather than an actual necessity as a medical condition.
Yeah, I can see Victoria said we need the government to be more explicit that non-surgical aesthetic treatments are not permitted except in explicit medical circumstances. So we've discussed that. And Harriet is asking, am I able to ask a question on remote prescribing? So is that happening now?
Yes.
Yeah. Go on, Fiona.
Yeah, well, it is. Some people never stopped. And we found that because there are practitioners, we know they were practicing, and it came out a few years ago now, the government said, it wasn't the GMC rather, said face-to-face consultations. And as doctors, we thought, well, there'll be work for the rest of us to do the prescribing. That never happened. No increase in requests, and these people are still working. So you have unscrupulous people, and a lot of them in this industry, and that's why the regulation is so important.
It's not worse in the beauty or in the medical, is it sort of even in...
Well, the medics are largely will be prescribers anyway. I think the nurses, in my experience, are the most ethical in that they will, they seem to be more frightened of losing their PIN numbers than but the beauty therapists are not regulated by the GMs. So you've got doctors who are still prescribing for them. It is going on.
So if there was a prescriber, see, all the groups who can prescribe, they are all regulated. So if you knew of a doctor or a dentist or a nurse prescriber or someone else who was prescribing remotely, all you need to do is refer them to the registration body, and they should be investigated. But it actually isn't the beauty therapist breaking any law if they use a product that's been remotely prescribed. It's the prescriber.
It's the prescriber,
I just wanted to say that but you have to ask the question when you see a Facebook post from a training provider asking for prescribers to go on their national register. You have to wonder, how is that being set up? Who are they linking people with? And unfortunately, like I said before, there are some people with their prescription pads playing fast and loose. Some individuals are getting these products and they shouldn't have them. They're dangerous products. And if you're injecting something and you don't know what to do, or you don't have a support network for your patients in the event that something goes wrong, then you shouldn't be allowed to be doing what you're doing. But it brings us back to the same thing again. We don't know who all of these people are. We don't know where they are. But we do know that some people that are writing prescriptions are getting the individuals to sign NDAs. So it's their way of trying not to be tracked whilst doing this.
You know whether you've signed NDAs, Dawn?
It's anecdotal, but we've heard of it when there's been complications as to, where did you get it from? Well, I'm not allowed to say where I got it from. I mean, honestly, it's as bad as it can get. I don't know any other industry that is allowing this to carry on.
I do, the gambling industry, don't get started.
Yeah, it's heartbreaking because it's an industry that can do so much better and does so many great things. And I have to say, the aesthetic nurses, the nurses that I know, with the doctor's decision to go back to work, they were appalled. They really were devastated by the announcement. It put the other ethical practitioners under a massive amount of pressure, because their phones have all started ringing off the hook. Well, if Dr. John down the street's opening, why won't you do that?
Yeah. Fiona?
Yeah, can I just start another point? The reputable aesthetic pharmacies insist on, they won't let you have an account unless you have a GMC number, a GDC number, an NMC number, and they properly regulate the product. Now, people who don't have access to that, and I'm not saying that suitably trained beauty therapists should be excluded, they should then be able to get an account, but at the moment they can't get accounts. So they're going on sites like fillerworld.com, and this is where you get all the other products coming in, and you don't know what people are getting injected into their faces.
Tell us a bit about fillerworld.com, Fiona. That's something that really fascinates me.
I just know that it sells filler at far too cheap a price, that it cannot be that what it's being portrayed as. So I think
UK company, or is it extra? Is it outside the UK?
Oh, I don't know. It's just an online company.
Can we do a bit of research around what is it? What's it called?
Fillerworld.com.
I think they're a UK company. My experience has actually been that their filler is more expensive because you can buy filler without a prescription, but you have to pay VAT. So they charge the VAT, and then they charge an extra fee because I guess
they charge much less for the filler. They charge much less for the actual filler.
Can I just buy a filler without prescription?
Can I just add? It would be good for the reputable prescribers to be acknowledged, because they're needed as a healthcare practitioner, as a supervisionary kind of level. But I know that a lot of them won't come forward because they're kind of pushed forward within their own industry and frowned upon for doing this. And obviously they're protecting, they're doing a very good job. So this is sometimes why it's limited. I've on regular occasions been offered product that is not legal, so it is available as the internet grows. So I think from a point of view, from kind of pushing it to a point of it's going to be available, so it's better to promote a regulatory system where you have a bank of professionals who are doing it correctly, are available in all network areas, that is regulated, that then can be tapped into, that are supervising correctly and are trained correctly.
What would the irreputable practitioners, be they beauty or medical, what would they hate us to do more than anything? What would be the thing that would completely paralyse them?
I think it would be totally wrong to monopolise this and give it to one factor, one sector alone. They do full qualification and a register has a full selected panel from all areas that is not actually geared towards profit, and it's self-regulated or mandatory or regulated from a level of it's a collective from all industries that is not monopolising, whether medics, non-medics, one training school, one area. It's safe.
What are your thoughts on that?
Well, I'd have to say that, it's like I said in my little 5-minute piece, it really is all there, ready to go. And the JCCP are a not-for-profit organisation. And when Michael said, you need and I've said the voluntary registry system doesn't work because the register will run on income. It's true. If there's no real...
Hang on, Chris, don't speak in. I'm going to ask Fiona and Michael the same question before we wrap up.
Yeah, if there's actually no need in law to make yourself known and to be on a register where you can be accountable and identified and verified and have your education in the area checked on a yearly basis, then a lot, you know, there are some in the industry that wouldn't want to see that. But I think if we are driving it from a patient safety perspective and protecting the economic benefits of the industry, then that's the way that we would have to go.
Okay. Fiona, I'm reading your comments, so if you want to just sort of come in on that one.
Yeah, I mean, I fully agree that we do need a register. The JCCP is set up. It seems to be linked into the already in existence professional bodies. The fee is 378 quid or something, and when you already pay over 400 quid to your own professional body, it's excessive. So bring that down, make it mandatory. And the other thing you asked, what would irritate people the most, is this business about if you clearly separated the cosmetic Botox from the medical Botox. The doctors that I've had experience with doing Botox, as soon as you try to suggest that there is cosmetic Botox, they are up in arms because you're just linking us with the beauty industry. I'm not. I'm just saying there's a clear difference between cosmetic and medical. And if the medical was subject to the same referral system as all other medical procedures, then they would have to pay VAT on all the cosmetic. And that would be the killer for them.
And like you're thinking, Fiona, you're devious like me.
I am, yes.
Michael, what's the worst thing that we could do?
The worst thing, well, I think the best thing rather than the worst thing, the best thing would be to regulate. The JCCP have made a start, but they've excluded anyone who isn't already on a register. So basically, they've just taken an easy job. It looks like they've decided to register people who are already registered with the GMC, the GDC, the NMC, so that's the doctors, dentists and nurses. They've excluded, as far as I can see, the people who aren't already regulated, which defeats the purpose. I think the people who aren't already regulated should be the first people to be regulated, and then add in the doctors, dentists, nurses and everyone else.
Don't we pick this up offline, because I know I can see you're not happy there. Harriet's made a good point, which is that Botox is prescription only, but there is a loophole through remote prescription. So the JCCP do not allow non-medics to join the register, which is part of the original problem which we need to look at, which is if they were able to join the register, then we would be able to close that loophole. Yeah. So I take that point. Very, very quickly, Dawn, because we're going to have to wind this up then.
Just that, Michael, the JCCP certainly didn't take the easy option. They looked at this industry as we are now in fine detail. They've got memorandums of understanding with all of the major organisations, and that decision was taken on patient safety alone.
Okay, and we will be looking at, we will be talking to them later down the line. Can I thank everybody very much for coming and say, keep in touch. Fiona, I really need to speak to you again. I'm sure Judith welcome an opportunity to speak. I think Dawn, we are speaking later in the week with Kevin. Yeah. Okay. Yeah. Thank you all so much.
Thanks.
Kath, do you want to stay on?
Thank you.
And Judith.
Okay. Thanks, everyone.
Thanks, everyone.
Bye. Bye. As well, wherever you are. Yeah.